Director of Midwest Integrated Medical Center in Hudson, just about 10 minutes down the road. And tonight we're going to talk about stem cells and amniotic allograft joint regeneration. Probably the biggest medical breakthrough of our lifetime, and maybe even our kids' lifetime. But before we get there, we've got another topic that we need to discuss. How many of you feel we have a healthcare crisis in America today? Yeah. Is it a healthcare crisis or is it also a health crisis? Both, isn't it? So let's talk about this health crisis first of all. So this is time for true confessions. What can we do as individuals to make ourselves healthier? What can we do different? We could eat better, exercise better, yeah. Stop smoking. We could probably reduce a little bit of stress. Anybody got stress? Right. So there's lots of things we can do, and we need to take more responsibility if we want to be healthier. Would you all agree? All right. So that's hopefully why you're here tonight. But now we've got this system, this broken system. What is broken about the system? Why do you think the system is actually broken? Money. Every time I lecture, that's the first thing everybody says, is money. So who's making the money? Pharmaceuticals. What else? Insurance companies. Yeah. And are the hospitals losing money for the most part? No. Are they making money? I know they're building lots out in our area, so they must be making money. Who's paying for all this? We are. Right. So we've got to do something different if we want different results. I'm going to just show you a few statistics here. Is America healthy? We make up 5% of the world's population. We spend more than all the rest of the countries in the world combined on health care, or disease management, if you will, crisis intervention. We consume over 55% of the world's medications. So are we unhealthy because we don't have enough drugs in our system? No. Got way too many, don't we? Yeah, there's a crisis there. So here's a lady by the name of Barbara Starfield, an MD and a Master's of Public Health. She was the head of the Health Policy and Management at Johns Hopkins Medical University. And she published an article way back in 2000 regarding the effectiveness of the American healthcare system. And here's what she found. So before we get into the third leading cause of death in America, what is the number one cause of death in America?
You talking about health or hospitals?
The number one cause of why people die in America. Heart disease. And what is the number two cause? Pardon me? Traffic? Nope, I wish.
Well, here in Chicago.
Yeah, what's that? Cancer. Cancer is number two. Does anybody have any idea what number three is?
Hospitals.
There we go.
Dying hospitals.
225,000, you're right on. 225,000 deaths a year from medical treatment in hospitals only is the third leading cause of death in America. 106,000 people die from properly prescribed and properly taken pharmaceuticals. Let me repeat that. They're properly prescribed, and they're properly taken, and we still lose over 100,000 people to that, side effects of that. 80,000 hospital-caused infections. You don't have an infection, you get into the hospital, you don't leave the hospital, you die. 80,000. 20,000 from other errors in the hospital, 12,000 from unnecessary surgery, and 7,000 from medication errors. So again, in 2013, they repeated this study that Barbara Starfield did in 2000. Unfortunately, Barbara Starfield couldn't participate in this research because she unfortunately passed away from taking a combination of medications. The thing that she was trying to bring light to, she actually died from. All right? So what did they find? They took the 17 highest income nations and ranked them according to their health. And where do you think the United States ended up? Bottom. Always. obesity, body mass index, diabetes, infant mortality, probability of dying between the ages of 15 and 50 years old. They now term the study the U.S. health disadvantage. So what is our purpose? Why am I here talking to you tonight? Because we need to change that. We do. And who's going to change it? Us. We can't be waiting for anybody. We're not going to wait for the pharmaceutical industry. We're not going to wait for the insurance industry. The big medical monopoly is just content making as much money as it can. They're not really interested in changing at this point. Because we pay for it, we're the ones that they're going to begin listening to. We're the only ones that can actually change it. So, we're going to talk about chronic joint pain tonight, shoulder problems, rotator cuff injuries, biceps tendonitis, arthritis, knee-related issues, cartilage damage, arthritis, bone on bone. By the way, there isn't such a thing as bone on bone. No. It's a difference between a pancake and a tortilla, but there's always cartilage there. Okay. So ligament tears, meniscus tears, elbow pain, tennis elbow, chronic sprain strains, hip problems, foot pain, ankle pain. We also help wrists, fingers with regeneration of the joints. So we use a team approach at our clinic, and we're results driven. It's an integrated medical team. We use medical doctors, we use nurse practitioners, we use doctors of chiropractic. We help with weight loss, and we help with nutrition, as well as amniotic allograft regeneration. This is me. My doctorate is in chiropractic. I've been a chiropractor for 37, going on 38 years. My postgraduate education is in functional endocrinology, the study of the function of hormones, why they go out of balance, how you can get them back into balance. Functional medicine. Has anybody heard of functional medicine? It is now the new paradigm in medicine that we have available today. Functional medicine gets at the underlying cause of why do diseases develop in the first place, and how do we begin to reverse that disease process. Conditions that we help are helping people reverse diabetes, even if they've been on insulin for a short period of time. Can we help somebody who's been on insulin for 20 years get off insulin? It's not going to happen. But if they've been on insulin for a short period of time, or metformin or some of the other drugs, we can actually help them. We got half the adult population, more than half the adult population in America, that is either pre-diabetic or diabetic. And we now have 25% of our adolescents that are pre-diabetic or diabetic. Our kids today, for the first time in our history, are not going to live as long as their parents. Have you guys heard this? Yeah, we're de-evolving. We're getting sicker, and our kids are getting sicker, and this has got to stop. I also have postgraduate education in functional brain-based neurology. That is the function of the brain, how the brain begins to deteriorate, and how you can begin to get function back to the brain, how you can actually repair the brain. Do we have a problem with brain-based issues in America today? Yeah, how about our older population? What's happening with Alzheimer's? Yeah, dementia, cognitive impairment, memory loss, balance disorders. What about our little people?
Yes.
Huh? How about what's happening with autism? You know?
They say that all kids have autism.
You're in special ed. Okay. So the CDC a couple years ago came out with a figure, 1 in 45 kids have autism today. Happens mostly in little boys compared to little girls. There's reasons for that. But that's just autism, 1 in 45. That doesn't count ADD, ADHD, tics, Tourette's, dyslexia. Pardon me? They give them a pill. And I'm going to tell you what the underlying cause is of all chronic health issues. Does anybody know, by the way? Has anybody heard what the underlying... It's a trauma to the body, but it's a very special type of trauma. It's called inflammation. Okay? Inflammation and the body. So it doesn't matter whether we're talking about diabetes, cancer, Alzheimer's, autoimmune conditions, cardiovascular disease. It's all inflammation. And what do we mean by that? You're here tonight because of inflammation of joints, right? They hurt. That's inflammation. But when we get systemic inflammation, our bodies begin to deteriorate. And so in order to begin to figure out the underlying cause of that, we have to go to where most of the immune system lives in the body. So does anybody know where 70 to 80% of our entire immune system lives in our body? In our digestive tract. Very good. This is the outside world inside our body. So our maker designed most of the immune system to be right there, to catch the bacteria and the bugs and the parasites and all that other junk that's going through there, right? So what we put in here, do you think it has an influence on that immune system? Man, does it have an influence on that immune system. See, if we don't begin to deal with that fundamental component of how we fuel ourselves day in and day out, we're not going to get at inflammation. We're not going to get at the underlying cause of chronic diseases in our country. And we're just going to get sicker and fatter, and we're going to hurt more, and we're going to die earlier. We got to change. We're the ones who can change. That's me. I love to play this silly little game called softball. I've got 8 world championships in senior softball. Well, thank you. It's nothing. No, the reason I'm telling you this is I'll be 68 years old this year. And do you think I might have suffered some injuries over the years? I've had this knee arthroscopically repaired once. I've had this knee arthroscopically repaired twice. The second time it didn't go very well. This shoulder dislocated 5 times. It's got torn labrum and arthritis in there. And I am a patient of amniotic allograft as of January of this year. And I can tell you 95% of all my joint pain is gone. My right shoulder has always been good. My left shoulder could go up about this high, and then it would feel like it was going to dislocate. No discomfort. In just 3 short months, but I began to experience the benefits just a few days after the injection. And we've got a number of our clients that are doing the same. So far, we're getting 100% positive results. We just had a gentleman in on Friday that got both of his hips injected. And he wrote an email to one of our prospective patients saying he's already feeling better. He's got more range of motion. The pain is decreasing. He's walking better in 4 days. All right. So there is potential here. Now, let me just state this very clearly. If you ever hear of a doctor who says amniotic allograft or stem cell is going to be the cure-all and the big fountain of youth, and it's going to reverse you, and you're going to, these joint problems, and you're going to be like you're 20 years old again, run the other way. That's not realistic. But what the regenerative therapy does is gives your body a chance to heal. That's what it does. Because as we age, we don't heal as well. It's why our little people, they can fall and get cut and get hurt, and how quickly do they heal? Bounce right back, don't they? And as we age, do we bounce right back? No. No. But this therapy is going to help us to bounce back, right? And we'll explain how that actually works. So let me just give you a little basic anatomy here. Here's a bone, here's a bone, here's a cartilage surface, here's a cartilage surface. There's fluid in there. The cartilage surface shouldn't be touching itself, right? There's no blood supply in here. We don't want a blood supply in here. The way we get a blood supply in there is through movement. We get nutrition through movement. So years ago, when people would develop arthritis, they would say, don't move, right? Now what do they say? Move, right? But you know what? It hurts, right? It hurts to move. So we have a couple of rules in our clinic. 1, no pain allowed. 2, you actually have to enjoy the movement. Otherwise, it's not going to be sustainable for you. It's not going to be a permanent solution, right? But do we need to move if we're going to be healthy?
Yes.
Yeah, but let's do it painlessly. Let's do it smartly, okay? So, arthritis is inflammation of a joint. Cartilage, tendons, ligaments are particularly vulnerable because they have a very poor blood supply. Adhesion, scar tissue cause joint degeneration, and movement prevents arthritis. But we've got to get that pain down first so that we can begin moving pain-free and rehabilitate. Does that make sense? Okay. So I'm going to just describe this particular picture, and we can extrapolate these spinal bones to any joint of the body. Left is a normal vertebra, normal discs. We've got the nerves coming down and exiting from the spinal cord. Everything's working the way it's supposed to. When the bones start to not move as efficiently, the discs start to dehydrate. That's called phase 1 degeneration. We get stress on the nerves and we can get pain. If that's allowed to continue on, we go to phase 2. That's the second picture on the right. We can get more disc deterioration. Do you see that arthritis beginning?